name is Margaret DeAngelis. I'm a professor at the University of Utah, Moran Eye Center, and I do research into the genetic mechanisms and epigenetic mechanisms of age-related macular degeneration. And what my program of research does is it tries to take a systems biology approach to looking at all factors that affect the disease pathogenesis. So what that does is it looks at the environment, the health risks like high cholesterol, hypertension, cardiovascular risk, as well as smoking history, nutrition, weight, as well as somebody's genetic makeup, and take all that along with disease risk, your genotype, and put that all together to see how that affects disease, or how it increases disease, how disease progresses, how it causes your disease to progress. And we try to find biomarkers that can either stop the disease from progressing, or possibly reverse the disease once you have it. And some of the ways we're doing that is we're taking a multi-omics approach. And one of those ways we're doing it is we're doing large arrays that have to encompass the whole genome, but they also encompass mechanistic factors that take into account the environment as well, and look at individual patients at the genomic level. So it takes into account looking at the DNA and the RNA, the second layer, how the genes are expressed, and looking how that interplays and how we can try to target things that are not just associated with disease but may be underlying disease mechanism, so that we can get to therapeutic targets. So what do we use for studying? What do we use as our target for studying? Well, one thing that people have done in the past, including us, is we used blood from living patients. But we don't know if age-related macular degeneration is a localized disease or a systemic disease. Localized means, does it occur in the tissues where the disease is manifest, i.e. the back of the eye, the retina? Or is it a systemic disease where when it affects the eye, does it also affect other tissues in the body? So we've decided we're going to focus on the eye. And being in Utah, Salt Lake City, we are fortunate enough to work with the Utah Lions Eye Bank. In our program of research, we include scientists and clinician scientists who are retinal surgeons who are able to diagnose the disease once we have a donor eye. And we're able to get those donor eyes fresh once the patient passes away, within 6 hours of postmortem. And that's important because tissue degrades very rapidly. It also, as you can imagine, when tissue is not part of a living body, it begins to swell and become edematous. So one must process it quickly and phenotype it, or look at it and make sure it has disease or doesn't have disease with special imaging techniques. And then we need to have it looked at further by experts who actually diagnose living patients to make sure that it has the disease we think it has, and whether or not it actually matches the medical records. A lot of people, as you've heard, can go through life and not even know they have disease, because let's face it, you don't go to see the doctor until you have something wrong with you. And unfortunately, age-related macular degeneration is a slow, progressive disease. Sometimes it can be fast, as in the form of wet age-related macular degeneration, and some people can go blind overnight with leaky, bleeding vessels. So we see patients upon postmortem that actually have age-related macular degeneration that were never diagnosed in their lifetime. They think they were normal, but upon further inspection with a proper, precise diagnosis and dissection, we actually see they have the disease. So we can more precisely study them at a molecular and cellular level. So we feel this is a very powerful way to look at patients with disease and without disease, and that's what we interrogate. The research we're doing, and we're thankful to the Macular Degeneration Foundation, which has allowed us to fund this research, is we're trying to identify biomarkers or therapeutic targets which we can target, which will slow down or stop the disease. Because it's pretty hard to prevent the disease. And unfortunately, the dry form is the most prevalent form of the disease. It seems to underlie both the end stages, which is the wet form, and the very end stage, dry form. And as you may know, we have the hallmark drusen. That underlies the form. And most of the population over the age of 43 has some form of drusen, at least 95%. What makes drusen become pathogenic and cause or underlie age-related macular degeneration is what we're trying to figure out. And that's where we want to stop the disease, at that early stage. So that's what form we're trying to study, is that early intermediate form. And there's been therapies in clinical trials developed to try to halt it there, or to stop geographic atrophy, or to work with geographic atrophy, the very end stage form of dry. There's a lot of therapies for the wet form that work fairly well, but they require invasive injections. But they work pretty good, although there is a small group that is resistant to that treatment. And they do not cure the disease over the long term. However, these trials have failed. So we have to come up with more precise and more focused approaches. And our way and our methodology, which we've used for over 10, 15 years, in other places have used these approaches, cardiovascular disease, cancer, other fields have used this, is to take a more inclusive approach using many lines of data, not considering one method of data, but considering many lines of data, many approaches at once, taking data from all these approaches, because it's also cross-validatory, using different mechanisms. Mechanisms isn't the word I'm looking for, but more than one approach. Epidemiology, clinical data, molecular data, genetic data, and bringing that all together. So if you were to design a clinical trial, you would also consider the person's genotype. You consider their cardiovascular history. You would consider their hyperlipidemia, their cholesterol history, because all these diseases are part of the aging problem. In our group, as well as other groups, have published that these diseases, cardiovascular disease, Alzheimer's disease, have overlapping pathways with age-related macular degeneration. So you can't ignore that. There's genes that share the same pathways, and there's overlying epidemiological factors like high cholesterol, stroke, hypertension. So those all must be considered when designing or thinking about a clinical trial, so you have greater success and hopefully that drug having some effect.